Mr. and Mrs. Roy, in spite of being medically fit, are unable to have a child. Frequent visits to gynecologists could not give them a solution until they heard of IVF. What is IVF? How successful is the treatment? Is it the answer to their worries?
In our fertility clinic and IVF research center at AMRI, we have a team of experts super specialized in treating problems of infertility. A gynecologist who is specialized in follicular monitoring, in ovum retrieval and embryo transfer. An ultrasonographist who is trained in follicular tracking for ovulation studies. An endocrinologist to treat hormonal problems. We also have a psychiatrist who deals with psychological problems, because as you know, when a patient after a long procedure does not get pregnant, they usually suffer from a psychological depression. We have now collaborated with Pacific Health Center at Singapore, where we are going to exchange technologies and idea and seek their expertise, and they can seek our expertise.
The doctor, after checking the reports, suggests a blood test, followed by ultrasonography and sonohysterography to check the tubes. Injections are given to stimulate the ovaries to produce the eggs. Sonography is performed frequently to see how the ovaries are responding. When the eggs are of right size, they are collected. This is known as the ovum retrieval process. The embryologist tests the eggs and keeps them inside the incubator for a few hours. Meanwhile, the semen is collected from the husband and left with the eggs in a petri dish for fertilization. The entire process is painless. The patient can go home after 4 hours. Generally, one can have up to 3 to 15 embryos. The embryos are stored inside the incubator, which has the same environment as that inside the mother's womb. After 48 hours, the eggs are implanted inside the mother's womb. This is called the embryo transfer. Normally, 2 to 3 embryos are pushed in. The rest are kept inside the freezer for future use. The patient is prescribed some hormonal pessaries and asked to undergo a pregnancy test after 14 days. Mrs. Roy's pregnancy test came positive. At last, so the long wait is over. IVF has removed her worries. Yes, she can be a proud mother of a healthy child. Indeed, AMRI has made a dream come true.